You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Ethnic noses, meaning African American, Asian, Middle Eastern, every one of them have a clear difference in the anatomy and also shape of the nose that requires understanding and correction properly. The African American have often thicker noses, so are the individuals from South America. And Asian noses often need to be built up rather than reduced. So we have to understand those nuances to be able to serve those patients better. And in fact, there is an expertise amongst us related to the ethnic noses, because again, they're not exactly the same. They're not, even anatomically inside the nose, African American noses have a little bit less cartilage to be used for some of the maneuvers that we need some cartilage for. So we need to be prepared for it. When it comes to the word natural, pertinent to the rhinoplasty, what most patients are referring to is a norm or beauty that is accepted by the majority without looking surgical. And in fact, going back to early stages of my plastic surgery experience, I became very focused on what is going to produce natural noses. I'm a craniofacial surgeon by training, meaning we analyze every millimeter of the face in details to decide how the bones are functioning, what they need to do, what we need to do to eliminate the flaws. And that knowledge actually came to my help. And over the years, I developed a scientific way of analyzing the face, matching the nose to the face, and creating proportionality. There are some faces that are larger and they need a larger nose to look natural. And those noses, a nose that may look perfect in one face is not going to look perfect on the other face. It's going to look unnatural. It's going to look surgical. And we can avoid that by adhering to certain beauty principles, angles, measurements. And I've published articles about it. It is in the rhinoplasty book that I have. And I teach that to the residents and plastic surgeons as to how I conclude what is going to give that given patient a more natural look. And I'm not the only one who got focused. There are others that have been focused on, but it is crucial for us to analyze the face, entire face, because the nose has to belong to the face and go with the face. And the advantage of doing this and this analysis, I also share the pictures, life-size pictures with the patients and show them what my plans are, what my aesthetic plans are, what are the alterations that I'm anticipating. And they have a good visual way of seeing what my goals are, my objectives are. So they don't wake up with a surprise after the surgery. And also it helps me to understand what the patient's desire. Have I ever declined a patient surgery because we're not on the same page? Extremely rarely, but it has happened. Within aesthetically pleasing range, there's a slight latitude that it still can give the patient a natural looking nose if we alter our plans minimally. But that is a small range, and I want to make sure that with every patient, I'm within that range of discussion. And it really gives the patients also more sense of comfort when they know that it's not about my personal taste. It's about what is considered attractive looking for by majority of the individuals. Even within that range, we have to really take a lot of ethnic differences in consideration, and we take care of that also. If anyone is interested in a rhinoplasty consultation, you can call our clinic, Ziba Clinic, 440 440-461-7999. Again, 440-461-7999. Or you can go to my website, drbahmanguyuron.com, and you can actually make your appointment through the internet. We're here to serve the patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.